Let's turn now to Dr. Ashish Jha, the Dean of Brown University School of Public Health. Dr. Jha, good morning to you.
Good morning. Thanks for having me on.
I follow you on Twitter and read what you described as a bit of a rant last night about the vaccine rollout. The federal government said we would have some 20 million vaccinations by the end of the calendar year. We've got 2 days left. We're at just over 2 million. What happened, Dr. Jha?
Yeah, good morning again, Craig. Look, this is frustrating, right? Because it's not like we didn't know vaccines were coming. It's not like this has caught us off guard. Two things have gone on. One is we have not gotten the vaccines out to states as quickly as we were promised. But that, to me, is the less important issue. The more important issue is that there really has not been much of a plan on what happens after the vaccine arrives in states. How do we get it into people's arms? And we just left it up to states, and states are really stretched. We've given them very little money. And we're just we're repeating all the mistakes we made with PPEs and testing all over again.
But to be clear, Dr. Jha, at least it was my understanding from the beginning that the federal government, federal officials said that the actual rollout of the vaccine, the needle in the arm, that responsibility would fall to local governments, local municipalities and states. Was that not made clear?
Yeah, well, look, there's two parts of this. I mean, the long-standing relationship in public health has always been a federal-state partnership. So that part is right. The issue is departments of health across the country right now are incredibly stretched with all the testing and everything else they're doing. They really need a lot more planning and help. And that planning of what do you actually do to get this out there isn't happening. So we have two choices. We can either decide that all of our 50 states are failing us. I don't think that's the right way to look at this. Or we can realize that we actually need a federal government to be helping states and not just saying to every state, you're on your own.
From a practical standpoint, right now, what should the federal government be doing to help expedite the rollout of these vaccines?
Yeah, I mean, I think there's a lot. I mean, first of all, I think Congress finally passed a bill that gives real money to states. I think that'll help. Personally, I'd love to see, look, we can stand up hospitals, field hospitals in days. We should be able to set up places to get people vaccinated. I would like to see places use things like the National Guard or other sorts of services. But again, part of the problem here, Craig, is we knew this for months and we just didn't do the planning. And now we're trying to play catch up. I do think we're going to catch up. I think states are going to figure this out. But I wish we had planned for this a bit more carefully.
Well, I want to talk about herd immunity, because as you know, over the last few days, there seems to be a bit of confusion over what's going to constitute this herd immunity. And we know that to get to the finish line here in the pandemic, we have to achieve this to a certain extent. 70%, we've heard 90% of the population would have to be vaccinated. What do you say, Dr. Jha?
Yeah, we don't know the exact number, right? And part of it is really depends a lot on exactly how contagious this virus is. And we know new variants are a bit more contagious. That may bump up the number. Look, the bottom line is a vast majority of Americans are going to have to get vaccinated for this pandemic to come to an end. Certainly north of 70%, somewhere in that 70, 80, maybe 90%. I think that number is changing because we're learning more about this virus. But the bottom line is most people will need to get vaccinated. I think most Americans will want to get vaccinated because we all want to put this pandemic behind us.